Hi there. Thank you once again for joining me. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. Today we continue our conversations surrounding medical issues in the COVID-19 pandemic. And if you have any questions and comments that you would like to send, you can do so by WhatsApp at 620-6275. or send an email to docandcovid@gmail.com. I'm wearing my mask right now just to ensure that it's covering both my nose and mouth, but for the rest of our discussion I will take it off using the straps. And we continue to answer questions and provide some kind of explanation for viewers and listeners who would have had some concerns. Remember, by now we have over 4,800 cases of confirmed COVID patients in Guyana. And so pretty much the majority of our population would know someone who either had COVID, has COVID, or will become at some point in their lives infected with COVID. Thankfully, as we get deeper into this pandemic, we're seeing breakthroughs, especially in areas of vaccination and preventive care, that offers a lot of exciting hope for us in the future. But let us look at one of the vulnerable groups, or more concerning groups, in our society and in the world at large. And here's a question that actually came in from an expectant mother. And here's the scenario in question. This young lady says, when I was 3 months pregnant, my husband tested positive for COVID-19. I was not tested, but I developed a lot of signs, a lot of symptoms. These include loss of taste and smell, fever, headache, and difficulty breathing. My husband, 3 children, and I quarantined together at home. I am now 7 months pregnant and having difficulty breathing. The question is, will this affect my baby? Notice here that the main concern of this expectant mother is for the unborn child. Will this affect my baby? The mom is more concerned about the child than she is about herself. And from the scenario, one can deduce that perhaps she would have had symptoms earlier in the pregnancy, felt well, and then now later on in the pregnancy, she has developed persistent or continuing shortness of breath or breathlessness. For us to understand exactly what she means, we need to have some definition or some concept of breathlessness. Breathlessness is known medically as dyspnea, or shortness of breath, which is essentially difficulty or labored or consciousness about taking a breath, and that is quite common during pregnancy. It may be related to physiologic or normal changes that are taking place in a pregnant woman's cardiopulmonary or blood system, as well as increase in weight or increase in abdominal size. That can cause shortness of breath, but that is a normal development during pregnancy. There are several degrees or variants in breathlessness. Orthopnea, for example, is breathlessness when lying flat. Paroxysmal nocturnal dyspnea, or PND, is the sudden onset of dyspnea at night, or dyspnea or shortness of breath. dyspnea on rest, and dyspnea may be mild, moderate, or severe. There are several physiologic causes. These are normal, expected reasons for a pregnant woman to be short of breath. Physiologic breathlessness starts as early as the first or second trimester and increases in incidence as the pregnancy progresses. It occurs in 60 to 70% of women, and thus is a common phenomenon. It is usually mild, and seldom is it incapacitating. The woman is usually able to perform routine activities. Breathlessness at rest, however, is uncommon, and tolerance to light exercise and daily activity are usually not affected in the usual pregnancy-related shortness of breath. So if those happen, then perhaps it is not the usual shortness of breath associated with pregnancy. The breathlessness in pregnancy, the physiologic ones are what we just discussed. But then there are other causes of shortness of breath that are due to disease states or pathologic entities or problems, and these are including things like anemia or low blood count. Remember that the blood count is the measure of the oxygen carrying capacity in the body, and so if the blood count falls too much, then you cannot then carry enough oxygen to satisfy the body's demand and needs. So one of the things that happen is patients can become breathless. The next big reason or a common reason that people may have shortness of breath is pulmonary embolism, or PE. We all have heard about asthma. This is people who have shortness of breath with wheezing due to hyperactive airways that are responding to something. Pneumothorax is when there's free air trapped in an area in the chest that it is not supposed to be. Pneumonia, of course, is infection in the lungs, and there's all kinds of severe complications of heart disease and infection, etc., that can cause ARDS, or acute respiratory distress syndrome. And in heart failure, persons can develop what is called pulmonary edema that is known to cause shortness of breath. Heart rhythm disorders or arrhythmia is also another quite common reason for shortness of breath in pregnancy. There's a rare but well-recognized phenomenon called peripartum cardiomyopathy. This is when the heart muscle, for one reason or the other, becomes quite ill as a consequence of pregnancy. It is rare but well recognized, and 1/3 of those patients can get better, 1/3 can stay the same, or 1/3 can actually get worse. And it's important for us to consider those, even though it's rare, as a possible reason for pregnant women to get shortness of breath. It usually starts off, however, in the later stages of pregnancy. What are some of the key messages that a pregnant woman should understand through this COVID-19? The majority of COVID-19 pregnant women have mild symptoms. These include cough, fever, and some shortness of breath. Currently, there is no evidence that COVID-19 pregnant women have transmitted the infection to the newborn during pregnancy. So there's no evidence that there is a mother-to-child transmission during pregnancy. Washing of hands and social distancing are the two most effective preventive measures against the COVID-19 infection. So the real question that was asked, will COVID-19 affect my pregnancy? There are two persons involved essentially in the pregnancy, the mom and the baby. And for the mom, there is currently no scientific published evidence that pregnant women are more at risk for COVID-19. And for the baby, there is no evidence to suggest that if you contract COVID-19, the infection would pass to the unborn baby. So those are two very important facts to bear in mind as it relates to, one, the mother, and two, the baby. Hospitalized women who are COVID positive and pregnant, however, can have a different type of experience. About half of hospitalized pregnant women with COVID had symptoms. And some hospitalized pregnant women who had symptoms actually had severe outcomes. And we mention outcomes in hospital in terms of their severity based on the numbers who have been admitted or required admissions to ICU, the numbers who would have required mechanical ventilation or being put on the ventilator, and of course the few who would have had death during pregnancy. Fortunately for us, even though we would have had several pregnant women diagnosed positive with COVID-19 in Guyana, we have had good outcomes in our mothers and babies. The other aspect that is quite important to consider is the whole concept of prevention from getting COVID-19 while pregnant. So the question is, I'm pregnant, how can I protect myself against COVID-19? Well, simple things remain true. Washing of the hands frequently reduces the chances of getting infection with COVID-19. Social distancing or putting space between the pregnant woman and others. Avoid touching of eyes, nose, and mouth. And if there is coughing or sneezing, she should do so into the elbow or into a tissue that can be discarded easily. The other important thing to consider when dealing with pregnant women is what happens to the need for breastfeeding. We know always that breast is best. That's our motto when it comes to feeding the newborn, and that is something I learned since in medical school, which is quite a number of years ago. And it is important that breastfeeding continues. So here are some facts as it relates to breastfeeding. Close contact and early exclusive breastfeeding helps a baby to thrive. It makes a baby grow and develop better. A woman with COVID-19 should be supported to breastfeed safely, hold her newborn skin to skin, and share a room or close contact with the baby. Women with COVID-19 can breastfeed if they wish to do so. They should practice respiratory hygiene and wear a mask, wash hands before and after touching the baby, and routinely clean and disinfect the surfaces that they touch. If a woman with COVID-19 is too unwell to breastfeed, she can be supported to safely provide her baby with breast milk in other ways. And these ways can include things like expressing breast milk from the mother. Relactation is another strategy. Relactation is if you stop breastfeed for a little while, get better, and then start to breastfeed again. So that's the process of relactation. And of course, there is something that is not quite practiced a lot in Guyana, but there's human donation of breast milk. And the last resort is for formula that can be used in babies. But remember, breast milk is still the best, and it is still advised that even in COVID positive mothers that they should continue breastfeeding, wear the mask while doing so, minimize contact, wash hands frequently, and all the other measures that we know that have served to reduce the transmission of this condition. There's a basic principle that the WHO recommends. all women have the right to a safe and positive childbirth experience, whether or not they have a confirmed COVID-19 infection. And these pillars include respect and dignity, clear communication by maternity staff, a companion of choice, and pain relief strategy. Mobility in labor where possible, and birth position of choice. So I hope this would have answered all the questions as it relates to pregnancy and COVID-19 and the risk of transmission to babies. Remember, if you have questions, you can send us WhatsApp at 620-6275 or send us an email at docandcovid@gmail.com. Thank you again for joining me.